Hi everyone, my name is Jeri Inmon. I'm one of the managers at Rehabilitation at Fisher-Titus Medical Center. I'm a physical therapist, so I've studied the human body for over 31 years. And so today I wanted to talk to you about a new treatment we have at Fisher-Titus called the Dolphin. Here's what the Dolphin looks like. They're little handheld, they look like pointers or pens, if you will. But inside there's a 9-volt battery, and the whole purpose of these little guns is that they administer electrical therapy impulses into your body over acupuncture points. So it kind of is a cool little hybrid modality that combines Eastern medicine. Eastern medicine is often referred to as the Chinese medicine or acupuncture, or just alternative types of things that we don't do here in America. And then it combines it with American electrotherapy science, and they have this great hybrid modality called micropoint stimulation. And the Dolphin is just a brand of that stimulation. So we've had it here at Fisher-Titus for a little over a year and a half now, and we have most of our staff in physical therapy is using it as an adjunct treatment for pain relief. So I wanted to share it with you guys because, as you know, when you start running, if you're not used to running and you're training for these programs you're doing, sometimes you have pain in your body that you're just like, where'd this hip pain come from? Where'd this foot pain come from? And sometimes you're stumped, and sometimes you can take Tylenol and it goes away, and sometimes those pains don't go away. So you might need to seek help from your physician or your practitioner and get some extra steps for pain relief. So therapy is one of those places you can ask for help to see a physical therapist. And here at Fisher-Titus, this could be maybe part of your treatment program. Some of the things we could treat with the micropoint stimulation are just simple little pains and tendonitis. So if you have hip pain or iliotibial band syndrome, knee pain, foot pain, plantar fasciitis, things like that, that's an easy pain relief modality. But sometimes people's bodies have really tricky pain syndromes that are hard to figure out. So an example is your pelvis. Maybe your pelvis gets kind of twisted or a torsion to it, and then you have this funny back pain, hip pain, pelvic floor pain, and it's just kind of complicated. Sometimes the Dolphin is a good way to start attacking the body because you can work through meridians of the body without actually going to the point. So you could work for back pain by doing some points on your foot, which is kind of neat. If you have neck pain, one of the treatment points, I could show you in this little protocol book, is you could actually treat points in the hand that reflect back to the nerve pathway to your neck. So it's really cool. So an example would be, if I had neck pain, I would have my patient make a fist like this, and there's a little crease right there by your pinky finger. And if I had the Dolphin, I could turn it on and hit, there's a point right in there. And then I find the spot. You can hear this high-pitched sound the Dolphin makes. And then when I get the spot, I'm gonna hit the button and administer about 30 seconds of electricity to that acupuncture spot. So that's what I'm doing right now. And it doesn't hurt. It's just like the tip of a pen, kind of pointy and pokey, but it's not a needle. So that's the good part, is you don't have to stick a needle in your body and cause pain. So that's that. I'm holding her hand because we have to have skin-to-skin contact of the practitioner that's delivering the Dolphin therapy touching the skin of the patient. So that kind of connects an electrical loop between us, which is nice. And you know, how many times in our lives we need human touch? This gives you back that human touch. And then with the point finder, we're gonna start looking for her acupuncture points. And you're gonna hear a high-pitched squeal. I don't know if you listeners can hear it, but there it is. And then we're gonna deliver about 20 to 30 seconds of micropoint stimulation to that spot. You might feel a little pokey tenderness, but it shouldn't be sharp and it shouldn't be painful. It's just kind of like somebody's pushing on you. Does that feel okay?
Yep.
Yeah?
No pain. Yep.
And then there's another spot here. We're going to find that one. Right there. There we go. So these points I'm doing are great points for stress reduction and anxiety reduction. There's also, there's also a point near your ankle that can do some good stuff too. They actually call it the Prozac point, kind of like giving a little shot of Prozac. Right, there's another one. So this area is called the triangle. The triangle that we're delivering. Do you feel anything?
Yeah.
Yeah?
It feels good. Yeah, no pain.
No pain.
Yeah.
Okay, good. All right, so you can see on her skin there's a little dot where it indented, but it's not poking, it's not breaking through the skin, and it did not hurt her. The other thing we noticed, some people turn a little pink or red. That's a histamine response, just kind of like when you get a bee sting or a itch or something, it'll turn pink and that'll fade away, and that will go down in about an hour. Okay.
Great.
The other cool thing the Dolphin does is it works on scar tissue. So a lot of us have had surgeries in our past. So a lot of people have had some type of abdominal surgery where they've had their stomach cut open. So women, sometimes they have cesarean sections after, when they have their babies, or they might have a hysterectomy, or the guys might have had their appendectomy when they were young, or gallbladder surgeries, things like that. And sometimes that scar right across the middle of your stomach is causing more trouble than you would ever dream, and it actually kind of cuts like an energy field in your body. So your legs might be affected by that gallbladder surgery, which sounds crazy, but it's true. So sometimes you can do the Dolphin Therapy on the scar tissue and get great results in your increased blood flow in the legs, less pain, increased movement, less muscle tension, less muscle spasms, and that all makes you a better runner, because you're going to have healthier nerves, healthier muscles, and less pain. So always think about your body as a holistic, it's one piece of tissue, and all of that connection is so intertwined that maybe something you did as a child, maybe even a scar you had because you jumped over the fence and ripped something, might be affecting you today as a 40-year-old, and you still have this issue kind of lingering. So it's really just a nice holistic concept to treat the whole body. The other thing I really love about the Dolphin is it can treat part of your emotional, part of your human being, which, when you talk about pain, most of us think of just physical pain, but there's definitely an emotional component to pain that just goes way back in our memory banks, and how we handle stress and pain and sleep and all of that. So the Dolphin, working through acupuncture points, can actually affect emotions. It can help lessen grief, anger, anxiety, stress. And so how many of us have anxiety, right? I mean, most of Americans do. And, sometimes your anxiety makes pain worse. So with the Dolphin, we can actually treat acupuncture points in the wrist that can actually calm down your anxiety, which will help you function better, sleep better, handle pain better, cope better, and that makes your life just a little more easier to deal with. So that's one of my favorite parts about the Dolphin. It's just an adjunct treatment to treat the whole body. So if you have any questions, we do, I'm open to questions. You can call me here at the therapy office, but if you want treatment, we do have to have a doctor's order, and we'd be happy to see you. But like I said, we just want to tie this into your running and your training. We know you guys have aches and pains. It's a real thing. When you're training for a 5K, I applaud you for your workouts and your training. You're very dedicated, but you will have those little pains, and we can help you if you need help. So thank you very much, and good luck with your training.